Let's discuss Class 5 composite restorations. In this case, the patient had gingival decay. What causes gingival facial decay? Generally, it's either sucking on mints or often soft drinks. So I'm removing the decay and sclerotic dentin with the round-ended coarse barrel diamond. I'm using lots of water in an effort not to irritate the gingival tissue and cause gingival bleeding. Next, I'm wiping the preparations with Tublicid Red just to scrub them clean. I'm now placing 38% phosphoric acid. If you're etching dentin and enamel, then just leave the 38% phosphoric acid on for 15 seconds. You could leave it on longer for the enamel, but you only want to leave it 15 seconds on the dentin so that the dentinal tubules do not collapse, preventing flow of the primer into the dentinal tubules and creation of the hybrid layer. So if dentin and enamel are together, just etch for 15 seconds and rinse it off. Suction the 38% phosphoric acid off with the aspirator directly off the teeth. Don't rinse it off because it'll flow onto other teeth. After you suction the initial part off, then you can rinse it and either use rubber dam or have the mouth isolated with 2x2s. Rinse the phosphoric acid off for about 15 to 20 seconds. Next, I'm placing the primer adhesive directly on the soppy wet preparations. Don't try to remove the water. The pledget carrying the primer adhesive will displace the water from the preparation. That ensures that the dentinal tubule is completely wet. Remember, the primer is hydrophilic. It likes water. It's drawn to water. So the carriers are acetone or alcohol. They follow the water into the dentinal tubules, pulling the primer into the dentinal tubules, creating that hybrid layer. You'll eliminate sensitivity if you'll leave the preps wet, because you'll remember the cause of tooth sensitivity is movement of fluid in the dentinal tubules most of the time. So if the primer is drawn into the tubules by the water and then set, those dentinal tubules and blocked, you won't have any flow of fluid in the dentinal tubules, and that will eliminate sensitivity. So I'm applying copious amounts of primer adhesive to the wet teeth preparations. Then I'm blowing the excess into a 2x2 until nothing wiggles. All the excess primer adhesive is completely gone. Once the primer adhesive is placed and blown off, you cure it for about 5 seconds. Always cure the primer adhesive to ensure that the primer in the dentinal tubules is completely set, ensuring no fluid movement in the tubules and therefore no tooth sensitivity. Next, I'm going to flowable composite onto the set primer adhesive in the preparation. Sculpt it just a little bit with your plastic instrument. Be sure you keep the tip of the flowable composite dispenser in the flowable composite. If you remove it from the material, you could create an air bubble. Just a little bit of sculpting prior to curing. Cure the filled resin for 60 seconds with a curing light. I'm now contouring the set composite with a small chamfer diamond followed by a 12 fluted carbide burr. Lots of water to minimize gingival irritation. Now here's the 12 fluted carbide burr. Just blending the margins into the tooth. This is a Shofu fine polishing disc. And be sure the disc rotates from the composite to the tooth. Light pressure, water irrigation. Finish with a composite polishing paste. I like to wet the paste with water. Very light pressure with a Profi cup. There we have it, very stable and aesthetic Class 5 composite restorations.